Hello, welcome to the Ontario Health Connection. My name is Deon Ambersley, and I am a therapist and life coach with a focus on women's issues and women's wellness. Today, I want to continue the conversation around how I would address a patient who is struggling with IBS. So as mentioned by my colleagues, IBS has a number of different ways in which, we would look at treating a patient. That could be through movement, it could be through massage, touch, it could be through diet. And what they all mentioned was how IBS is very stress sensitive. So we want to look at how to minimize the stress response in a patient. And often when we talk about physical ailments, we don't tend to look at the connection between, the mental and the physical. And this is essentially where I would come in, because we would look at how can I regulate my stress response so that I am not getting those flare-ups. And not only the stress response, but one of the things that patients with IBS often talk about and struggle with is anxiety. Because the symptoms of IBS can be so unpleasant, there is anxiety around when will they flare up. So these are two things that we would look at. So we'd be looking at, how can I cope so that I am not feeling stress? But then there's another part that we would look at is how can I restructure or rethink about what is happening to me so that I'm not feeling as anxious. And one of the well-researched techniques around IBS, where they've shown to have a lot of positive outcomes, is CBT. And CBT stands for Cognitive Behavior Therapy. And the premise behind CBT is if I change my thoughts, it will impact my feelings, which would create a different behavior. So essentially what we want to be doing is changing the thoughts, right? Changing the way a patient with IBS perhaps looks at things so that there is a different feeling and a different behavior. So that is a way that we can bring the stress down and bring the anxiety down, right? Essentially with anxiety, we're looking at how can we kind of remove that fear response. So if I was working with a patient with IBS, this is something that I would do, perhaps using a few sessions of CBT, helping them to also look at, okay, what are some coping techniques for in the moment when I am feeling stress? So it could be deep breathing. It could be, do I need to expand my self-care? What are those things that I need to do to feel as if I am not feeling as stressed out? Because there is a definite connection between the mind and the gut. There is a connection there. So if you have any further questions around, how to manage IBS in its various ways, we would all be very happy to hear from you. Feel free to reach out. And in the meantime, look out for our next video. Thank you.